Good afternoon, everyone. World Sleep Day is an annual global call to action about importance of healthy sleep. The focus of World Sleep Day is to bring awareness to the importance of healthy sleep and prevention and management of sleep disorder. Good afternoon, everyone. World Sleep Day is an annual global call to action about importance of healthy sleep. The focus of World Sleep Day is to bring awareness to the importance of healthy sleep. Yeah. Today we have an expert panel to address queries regarding this.
Right. So to kickstart the panel discussion, so we thought initially there will be a round table discussion, which will be triggered by a particular question. And so after a couple of rounds, we'll have enough discussions, and after that, participants can ask their own questions. So the first question is to Dr. Bindu M. Kuti, who is Professor of Department of Neurophysiology and Center for Consciousness Studies in charge. Ma'am, what is your comment on this year's theme for World Sleep Day? Quality sleep, sound mind, happy world.
Thank you, Rahul. Very good afternoon and welcome to this panel session. Rahul, you have asked a very relevant point, actually, you have pointed out that this year's theme is quality sleep, sound mind, happy world. And even if you look at last year's theme, also similar theme actually, regular sleep and healthy future. So with this, I think the World Sleep Society wanted to convey certain awareness and message to the public, especially to educate the public on the importance of sleep in health and well-being. For example, see, we have to have a good night's sleep to wake us up afresh. So that buzzword is afresh. That is, you have to have a refreshing sleep in the night, in the previous night, for you to have to be very happy, very energetic, and also to be highly motivated to function all your day activities very efficiently. So this is very, very important. And that is seen especially when there is a sleep deprivation. Even for a few hours in the night, you get up, you will not get up afresh. You will be very lethargic, very confused. There is reduced alertness, increased sleepiness, reduced concentration. So you see that your mood is gone, your mood is disturbed. There is emotional disturbances. You will not have any enthusiasm to carry out any work because there is intrusion of sleep in the, while you are awake. So that can be overcome only in the subsequent night's sleep. So that means we have, we have a mechanism, a phenomenon called the sleep rebound. The sleep rebound is a boon of the nature that you can compensate for the loss of sleep. But that is only in the case of acute sleep loss. Whereas chronic sleep loss, definitely that sleep disturbances or sleep deprivation is a predisposing factor for various comorbidities like cardiac failure, cerebrovascular disorders, metabolic disorders, impaired daytime functioning, immune dysfunctions. There are many cognitive dysfunctions and so on. So you see that all these definitely highlight the importance of sleep in health and well-being. And also sleep is very important for you to face the world, socially with a proper social functioning and proper. So these are all very important, and that is what the theme highlights. And I would also like to mention this. If you Google, you can get this Sanoid tribe in the Malaysian peninsula. If you read that Sanoid tribe, they are the most happiest and non-violent people. That's what is written. Non-violent people on this planet. with a near perfect mental health. And the beauty is that the Sanoid tribes, the mothers encourage their children to dream in the night, and they also encourage their children to discuss about the dream the next day. And this practice helps them to overcome their fears and worries on life. And this is an example to say that, or to highlight the effect of collective dreaming in transforming a society towards a social well-being. So these are all examples, and this is what is actually highlighted through this theme: quality sleep, sound mind, happy world. I think that is enough. No?
Thank you, Dr. Bedru. So it was very insightful to know that, say, parents, mothers encourage kids to dream in Braille. So thank you.
So the next question is to Dr. Gulshan Kumar, Senior Research Fellow at Center of Consciousness, Department of Neurophysiology. The question is, what is the relationship between daily sleep and mood?
So there is a very intimate relationship between daily sleep and mood, means your whole day emotions, whether it's negative or positive. Now, question is like, in other words, we ask this question, whether your sleep disturbances or your night sleep is affecting your daytime mood or daytime your affective states. So, or the daytime affective state affecting your sleep. So these are the two questions, and is there any relationship between them? So if we see that many studies that they have done, researchers have done that, okay, they have seen that sleep disturbance is there and what is the impact on the next day. Okay, so if next day is there any impact on the affective state? So it has been shown that, okay, if during the night sleep disturbances are there, like because of your environment or your you are traveling through, you are traveling or any other ways which are disturbing sleep. When they were asked to rate their affective state during the day, it was more towards the negative mood. So your negative mood is also affecting your emotional well-being during the daytime. How? Because when your mood is negative during the daytime, so what it is doing? It is doing when you are interacting with other person. So if that person is also in the anger mode, and you will show more anger, but you will not show happiness when next person is happy. So these kind of emotional compromise you can see if you have sleep disturbances in the previous night. So there is a relationship between the, okay, this is our sleep is affecting our emotional health. But another question is, okay, whether if last night my sleep is good, but emotional health is bad, like compromise, means whole day I had sadness, anger, I'm very down or not that much inspired. So those kind of things are there. Does it impact my sleep? Okay, so that question is very relevant if we throughout the day and we are sad because of some work or some, but does it affect our sleep? Yes, it increases our sleep latency. Okay, and sleep duration reduced, and number of awakenings are there. Even though we will have negative dreams with that, so our sleep will get disturbed if negative or our emotional health is compromised during the daytime, and subsequently next night will have disturbed sleep. So in both way, it is like a bi-directional relationship you can see here, that yes, emotional well-being as well as our sleep both are related, and if we correct both, we will have very overall sleep well-being as well as emotional well-being. And moreover, if we see this neurophysiological or neuroimaging studies that because of sleep loss and during the REM sleep, we see that more negative. There is activation of amygdala, higher activation of amygdala. But in case of and this more activation of amygdala is also related to your depressive kind of symptoms. So that relation is also there. If in a way is we can say that okay, if your emotional health is compromised, your sleep loss is also there, it may impact further to your other brain area, and that may impact your further life in you can say in more depressive symptoms or compromised overall well-being. And I think I have.
So that means in the emotions, during the day affect your sleep.
Yes, ma'am.
And even the sleep, the emotions during the sleep also affect the next day, your life.
Yeah, emotion disturbance in sleep.
Yeah.
That affect our
Yes.
next day,
Yeah.
daytime overall emotional well-being.
Yeah. Very nice.
So sleep and mood are indeed very interconnected processes, and it's very important. Both are very important for well-being and living a very happy life. So we'll move on to the next question.
Right. So next question is more of a generic concern which many of the people have. So most of the times we wake up at the middle of the night and we take some more time delay to get back to the sleep. Is that normal? So this question is directed to Dr. Aaron, scientist, Center for Consciousness Studies, NIMHANS.
Rahul, for that question. I think this is one of the common questions even I had faced when I started some of the work with sleep, and something which is very commonly asked by most people. Because when we study sleep or when we learn about sleep, the general impression is that sleep is a constant process. We sleep at night, say 9 o'clock or 10 o'clock, and we wake up in the morning. And we feel that it should be a continuous process. But what many times we do not address is the sleep is a cyclical process. It's like repeated. You will have light sleep, deep sleep, and then dreamy kind of phase. And this whole thing happens within, say, 1.5 to 2 hours. And this whole cycle can repeat again and again. And the question is, why is it cyclical? Why can't it be one single stretch? Have all your slow sleep happening in the initial part and all your dream happening in the last part, and then you wake up. In fact, if you look at other organisms, you'll figure out that there are organisms, say, animals, deers, cattle, etc. They tend to have short sleep bouts. So they have short bouts of sleep, then they are awake, they graze the grass, come back, again eat, then go back. So each of these small bouts helps them to be awake, and so that they can interact with the environment, check for security reason, and then go back. There are organisms who can continuously sleep for a very long period when they are having their sleep in closed environments and then. So this whole thing is there in all of our genes. We all have that, because of which we also have cyclical pattern. And after every cycle, there is a propensity for us to be awake and interact with the environment. As a culture, humans have been sleeping in closed, packed environments, because of which we will have 2 or 3 cycles where we are continuously asleep, and probably the third cycle or second cycle end, we might have a higher propensity to get up. And this has been found in many individuals, and in fact, there is a genetic predisposition for some individuals to get up more often in the middle of the night after, say, 2 cycles or so. Whereas some people, though they wake up for turning around, etc., they may not even realize that actually they have a very short period of awakening period. So during sleep studies, if you look at it, you can figure out that there are clear longer stretches of awakening somewhere in the middle of the night. But for some people, that awakening, after that, they will have to interact with the environment. They'll have to get up. It will take longer period for them to go back to sleep. Those are the individuals who consider this a problem. They feel that I'm supposed to get continuous sleep and I'm not able to. But it is normal, and it is good to actually, in such individuals, it's good to get out of the bed and move around and then only come back to sleep. Because the time you spend in the bed in this awakening state actually harms your sleep hygiene. So it's better to get up, move around, and then when you feel sleepy, come back to bed.
Thank you, Dr. Arun, for clarifying that. I think it will be relieving for many of us to know that it's normal and we don't have to worry that just because I took half an hour more somewhere in the middle of the night, still I had a good sleep. Thank you for the clarity.
The next question is, when do we say a person is suffering from insomnia disorder? This is addressed to Dr. Sheshagiri, Assistant Professor, Department of Neurology.
The question looks very simple, but the definition is very complex. Like as we go understand, like people have sleep disturbances for many reasons. All the sleep disturbances, can you call it as insomnia disorder? It's difficult to say. Transcendently, some people develop regarding any space events, or like we have any medical illness, and then they will develop a few days, and then they will improve. And then it's not insomnia disorder like sleep is not like a constant. Some people will develop few days, and then they improve again. And then some people will have a underlying cause for the sleep disturbances, like rest like syndrome, or else like OSA. So like when you call it as especially a person is suffering from insomnia disorder. So to answer this, the consensus statement says that at least the person is suffering from the sleep problem, whether it is a sleep initiation defect or maintenance problem, or he states of therapy. That is the 30-30 rule. You can call like it is initiating sleep more than 30 minutes, or in between he also sleep, and then he is not able to regain and go back to sleep within 30 minutes, or he wakes up early 30 minutes before their desired time of awakening. And then this is repeatedly occurring at least 3 days per week, or it is continuing more than 3 months. So we can call it as a person is suffering from the insomnia disorder. Associated with the person should have a daytime consequences, right? If you have any fatigue or daytime somberness, that should be there. Then only we can call it the person is suffering from the insomnia disorder. I think that answers your question.
Thank you, Dr. Sheshagiri. We'll move on to the next question.
Yeah. So the question is there any relation between reduced sleep and memory loss in the elderly? This question is addressed to Dr. Aviyadan, Professor of Neurology, NIMHANS.
So we have to understand that what happens in normal aging and then what happens in the conditions where there is a neurodegeneration going on. So normally also memory strengthening happens during the sleep that we are all aware of. But in the elderly anyway, there are changes in the normal physiology which happen in the form of reduced deep sleep, which we call N3, reduced REM sleep also occurs. Now these changes in healthy aging are well compensated. But what happens in conditions where neurodegeneration occurs? For example, Alzheimer's disease, Parkinson's disease, and any of the other neurodegenerative processes. Basically, there are again two-way association. One is that because of their primary degenerative processes, the areas in the brain which are supposed to actually enhance the memory, they get involved. So again, the memory, for example, in Alzheimer's disease, the consolidation will not happen, and the storage which occurs in certain parts of the brain also will not happen. On the other hand, the disease processes involve the suprachiasmatic nucleus, which is like a pacemaker. So the sleep fragmentation occurs, and circadian rhythm disturbances means day, night, when they sleep, when they wake up, this whole system gets damaged. So then that has again implication on the sleep, the memory, and then this process continues. So this is one aspect. In some of the disorders, there may be the fragmentation may be so much that it qualifies for insomnia almost. Whole night the patients are awake because of their motor problems, that they are unable to turn on the bed because of the stiffness, etc. So it is like a two-way association. And healthy aging, we have to differentiate between the. So as soon as we find that there are markers in the sleep of elderly, like fragmented sleep, multiple awakenings, and which is causing more daytime somnolence, we have to get them evaluated for any of the degenerative or the common causes like obstructive sleep apnea, etc., and consult a sleep clinic.
Thank you, Dr. Vijay, for addressing the query.
The next question is addressed to Dr. Ravindra, Associate Professor, Center for Consciousness, Department of Neurophysiology, NIMHANS. Are sleep hygiene practices effective in treating in sleep problems?
So as we know that we practice various hygiene practices. So we have hygiene practices with concern to nutrition, exercise and all those things. So there is also a prescribed hygiene practices to have a normal or the optimal sleep. So generally, this has not been much elaborated upon. But so first to understand what are these hygiene practices. First and foremost is the sleep timings. So we have to have a very maintain the schedule of sleep time and the wake up time, and to maintain that as much as possible. But however, in some cases, even if the sleep time can vary, but we have to always have a constant wake time. So this is with regard to maintain the homeostatic mechanism which regulates the sleep. And the other important factor which we have to keep as far as the sleep hygiene is concerned is the environment in which generally we sleep. So this is a very ideal environment in which where the sleep hygiene is being prescribed. Otherwise, it depends on the culture, it depends on the geographical location and the facility that is available. But however, an ideal condition is that you have to confine your bedroom for the sleep and also for the physical intimacy with the partner. But it should not be associated with any other activities. And room should be very dark with the optimal and comfortable the temperature. And the other also thing is that we should avoid caffeinated drinks after the evening, because we know that these caffeinated drinks will excite the neural network and it prevents the sleep onset. And also heavy exercise late in the evening is not prescribed because it prevents the sleep. So no heavy exercise late in the evening. And also we should not have heavy meals late in the night as well. And the other important things that we have to keep it in mind, especially all of us nowadays, is at least half an hour or 40 minutes before our bedtime, we have to switch off all our gadgets. So it could be our mobile, laptops, or whatever the electronic gadgets. We have to off it, right? And then get into sleep. So why all these things is told is because we have to prepare ourselves also get into a sleep, because we cannot get into a sleep in a very agitated state or a disturbed state or emotionally charged state. So to calm down and cool down our mind and prepare ourselves, so get into sleep. So these are this sleep, these hygiene practices that has been prescribed. Whether these sleep hygiene practices will be very effective in the sleep disorders per se as such, it may or may not. But however, having these sleep hygiene practices along with other, it could be with medication, or it can be with, if you have a very chronic insomnia, it could be with cognitive behavior therapy along with sleep hygiene, or we have so many other non-pharmacological interventions also. So in combination of all these things, sleep hygiene could add to get into sleep. But if only sleep hygiene, whether it brings about any as a good therapeutic effect for the sleep disorders, so it may not be, especially with the chronic sleep issues.
Thank you for enlightening us with all this information. So I think compared to any other disorder, when you mentioned what are the things we should follow in sleep hygiene, it seems all of us have one or two things which we need fixing for sure. I don't think there are any other disorders where we feel, okay, I'm fine, I have no issues, but from whatever insights you shared, it seems all of us have something or other to fix.
Especially with the gadget use and caffeine consumption.
Right. Any relation with the blue light?
Yeah, blue light also plays a very important role. because blue light or the dim light is known to close to the circadian.
So in the
clocks.
screen nowadays, they say there are
To have a blue light,
filters.
yeah, filters that is available.
And it prevents the melatonin
It
secretion.
prevents the melatonin secretion. Yes.
So melatonin is one of the feel-good hormone. It is very, it elevates your psychological mood. It reduces anxiety. So it is a very good anxiolytic actually. And also it is important to maintain sleep. So melatonin secretion is hampered by blue light mainly.
But it seems recent studies have found that the filters are actually causing more harm. So avoiding gadget is the best thing.
That is the best, yeah.
So I think since the panel has completed one round of discussion, there are just a couple of questions which is generally to the panel. So maybe we'll take up 2, 3 and then move to the second round for discussion. So.
You can do it.
Yeah. I'll just read out a couple of queries from the participants. So, first one was, please share your experiences about genetic inheritance of sleep disorders. It's open to the panel, so.
Experiences about, so we have whatever limited, as per literature, RLS, restless leg syndrome, is associated with some of the some predisposing gene of iron transport. So the people who have those mutations, they have familial RLS, and that is linked to the iron transport and relative iron deficiency in the brain. Apart from that, there in narcolepsy there are predisposing genes, and also in some of the dementia associated. Also, there is a condition known as fatal familial insomnia, which is a prion disease basically. So I have seen at least 2 cases of fatal familial insomnia where it is an autosomal dominant condition, but it is not always insomnia with which it presents. It can present with the dementia, Parkinsonism, a combination of that. So genetics do play a role in sleep disorders, but there is no one-to-one connection except some of the autosomal dominant these conditions. But predisposing gene are predominantly present, like iron transporter.
I think even with respect to sleep duration, I think a recent study has compiled and found that 72 to 76 genes are involved, which affects sleep duration. 1-to-1, each gene can hardly affect like 2 to 5 minutes of sleep duration. But as a combination, they are known to affect up to half an hour change. And recently, I think last year, somebody has found the second gene for short sleepers. But the gene is identified from live studies, but they have found one family traits where these 2 genes are there.
Otherwise, there is also a genetic predisposition of whether the individual is active during the day or during the night also.
Chronotypes.
So chronotypes type of.
Exactly. So the circadian rhythm gene, the PER, and there is clock genes. Basically, in the clock genes, also if there are certain some SNPs which are associated with some particular patterns of sleep disorders.
So especially evening chronotypes are known to be more susceptible for psychiatric condition, like it can be for depression or.
I think that was very nice.
Thank you. So second question is there any direct connection between sleep and schizophrenia? If so, what is the pattern of the sleep, if there are any, which can regulate this?
I've studied schizophrenia and their sleep earlier. So the direct connection, the problem is we do not know what causes one. If you look at schizophrenia as such, it's a neurodevelopmental disorder. That means the problem would have started in the early development itself. And progressively, when the symptoms start coming in, sleep is affected. So in the early periods, sometimes as in depression, the sleep might be more. It is known to be compensatory. But then when the agitation, the positive symptoms are more, it starts coming down further. and subsequently in chronic stages, sleep is usually disturbed. But then what we have found is, in my study, for example, if you take the initial period, people who are in the early stages of their disorder, they tend to sleep longer or even normal in terms of duration. But the difference is that whole duration that they are sleeping has a lot of breaks. And in my study, I found that the breaks also have a specific period. Like Dr. Ravindra was mentioning, there is this chronotype effect too, because their problem happens when they go into sleep, the sleep is disturbed. But after that second cycle, they sleep very well, much better than even some of the normal people. And because they sleep deeper, now the third cycle onwards, the disruption starts coming. So it seems that most of the problem is onto the REM period, because most of the problems will start coming in towards the second half of the sleep. So from that perspective, yes, sleep has an effect. And the other thing we have found is hormone level itself. A hormone called adenosine, which when it rises, it actually allows you to go into sleep. And it is related to general day activity. The more you spend in wake period, adenosine builds up, and that helps you increase your sleep pressure and go into sleep. And the problem is we have hormones which will kind of degrade this. Now, if these hormones are not proper, these enzymes are not working sufficiently, the degradation is slower and slower, because of which, if it is too slow, after your first half of your sleep, now the second half doesn't have enough sleep pressure, and the adenosine levels are also slightly on the higher side. So this dissipation is not happening properly, and that can add on to your disturbance. And by the morning time, if the adenosine level has not come down sufficiently, daytime symptoms, psychotic symptoms actually aggravate. So, and this may be different. Every patient may not have this discrepancy too much. We have found some people where this drop in adenosine is not sufficient. They have more positive symptoms in the daytime. People who have it more, they have negative symptoms. So the duration is not the major thing. How the sleep progresses during this period, and that is different based on their symptoms. So as a whole, schizophrenia may not be caused by sleep, but their whole sleep, their pathophysiology can affect sleep, and that sleep problem can affect their next day-to-day symptoms. So it's a loop, but yeah, one-to-one relation is still not studied. We wanted to study one where we wanted to identify people with schizophrenia where they have sleep problem, try to improve their sleep artificially and see if their symptoms come down. So once we do that kind of studies, we can do that one-to-one correlation better. Currently, it's mostly association, and most bulk of this schizophrenia people have disruption in sleep.
And one more thing, I can share more information that those who don't have much sleep, I mean, patients, their symptoms aggravate in the daytime.
Correct.
Whereas they have a good night's sleep, the problem subsides.
Correct. So as I mentioned, the sleep actually modulates all these hormones, including adenosine. And if that doesn't happen sufficiently on a particular night, the subsequent daytime, these hormones are in unbalanced state, and that can aggravate their negative and positive symptoms.
Thank you. So maybe I think we'll just take 2 questions, go to the second round of discussion, and remaining questions we can take at the very end. So what are the recent advancements in the field of yoga and sleep?
Yeah, there are a lot of studies on, I think you can also join me later, yoga and meditation, especially what is the effect of yoga and meditation on our mood, on our whole system per se actually. And studies have shown that it enhances your psychological efficacy, cognitive functioning. So there are many studies to prove this, but there aren't much studies on sleep. But we have our team, we have undertaken sleep studies for a long time, almost 20 years. We have been into studying a role of especially meditation especially Vipassana meditation on sleep organization. And these are very interesting studies. Before our study, there are only very few studies, and that too, nobody has looked into the sleep organization as such. Only very few, ambulatory states people have studied. But throughout the whole night sleep studies, I think we were the first people to look into. And we have observed that, and also one more thing you have to keep in mind is that when we say meditation practice, you have to really practice this technique very diligently every day. And you have to be very proficient in this meditation technique. And not only practicing technique, but also understanding the philosophy, based on this technique, so that you can see the personal growth. Otherwise, you may not get the expected result. So we have studied and we have seen that the meditation proficiency related changes in sleep organization. And we have observed that their sleep is very, very perfect, we can say, that with reduced sleep onset latency, reduced intermittent awakenings, enhanced deep sleep state, enhanced REM sleep state. In general, we can see a proper sleep organization. And this sleep quality is maintained across age. That was Dr. Ravindra has carried out a study to look at age effect. As you know, already Dr. Ravi Yadav has narrated that age deteriorates your sleep quality. So we can see age-associated changes in non-meditation, normal, healthy controls. Whereas here you can see the preservation of the sleep with quality among very proficient meditators. So again, I'm just telling that it is not simply a meditation practice. If you are very proficient in the meditation practice, maybe any meditation practice, I can say, definitely it will influence your sleep and you will have a good night, a good quality sleep. So as far as sleep organization is concerned, we have observed these changes. We have also looked into the science behind it. For example, they have a proper cardiovascular functions. Like we can say that it is a parasympathetically predominant sleep, whether it is a deep sleep or even REM sleep state. You can see very highly active parasympathetic, activity. So that ensure a proper cardiac health and that ensure a proper sleep state, especially even REM sleep, proper REM sleep, because usually REM sleep is associated with enhanced sympathetic. But along with the sympathetic surge, we see a very enhanced parasympathetic activity. Also, we have observed enhanced melatonin levels in these meditators. The melatonin levels are almost 3 times more than that of the controls. So there are, we have seen, and we can say that because we have conducted many studies. Even we have also looked into the various aspects of the REM sleep organization. So REM sleep, for example, the RIMA, the rapid eye movement activity itself, that is an indication of enhanced plasticity, enhanced brain activity, especially the frontal brain activity associated with REM sleep. So we have seen quite a lot of changes associated with the meditation practice.
The other thing is also the yoga practice, as Madam was mentioning about where it can bring about the changes in the neuroendocrine profiles. So along with increase in melatonin, so there was also a decrease in cortisol and also an increase in DHA, because both cortisol and DHA, they are counter balancing with each other. So whatever the adverse effects of cortisol is there, especially in the early morning phase where the cortisol increases. So to bring down the sympathetic surges, especially with the REM sleep, right? So when parasympathetic, the parallel increase in parasympathetic activity will be there. So we have also seen that there is a corresponding increase in DHA also in meditators, but not in the in non-meditators. So this DHEA is also known to be one of the sleep promoting the hormone. And also there are a couple of studies, which have reports which have shown that yoga nidra practice, before getting to sleep can facilitate, get into a sleep better. So because two important factors which can disturb sleep is the pre-sleep cognitive arousal or the pre-sleep somatic arousal. So these are the two important things which can really delay your sleep onset. So therefore, to reduce the pre-sleep cognitive arousal or pre-sleep somatic arousal, so these deep relaxation, shavasana, and yoga nidra, so before getting into sleep, will be very, very useful.
So I think many questions in the chat box, I think will be addressed in the second round of the panel discussion. So we'll move to the second half of today's panel discussion. So is there any relationship between objectively measured total sleep time and positive affect or positive mood the next day? So this question is addressed to Dr. Gulshan Kumar.
So it's all depend on this objective sleep duration. That it is also one parameter of to see our sleep efficiency or overall sleep quality. Another is okay, if the question is like, okay, we have less sleep time like 3-4 hours and it will impact our daytime mood or our emotional health or some cognitive task or ability. So yes, if you take less sleep, and definitely you will have cognitive decline or your mood during the daytime. But in other ways, if we see that, okay, if our sleep is increased, like if I sleep 15 hours, will it give us more happiness, joy, or we will become cognitively okay, better? No, it is not like we have fixed timing, like fixed 7 to 8 hours normal average timing. Okay, this is what we have to sleep. If we sleep more than this, will it affect our increase our well-being? Okay, no, it is not like that. But in some cases, it's a contextual work. Mostly, if you are sleep deprived like 3-4 days and you sleep for 10 hours, definitely it will increase your happiness and joy as comparison to the preceding days. But as such case, in case if you have you want to sleep more and you think that you will have better day next day, no, it's not like it is seen that okay, sometimes you become more sad if you have sleep like 12 or 13 hours. Okay, so if we in overall scenario we see 7 to 8 hours sleep is better. Don't think that sleeping more will help me for recovering more and that. Yes, in case of sleep deprivation or some kind of sleep disorders are there, like some kind of mood disorders are there and you are not sleeping like last 1 month or 10 days, 5 days. In that case, first few days increased sleep gives you a better health, but not in a long term. So sleep duration is a very important factor, and if you sleep more than the prescribed limit, it may not give you a better result, but may sometimes give you bad result, or you can say compromise result of your health. Okay.
Yeah. Thank you, Dr. Gulshan, for stressing on those aspects, because in our hectic schedule, we think, okay, 5 days you work hard and you just go to a slumber for the weekend and things are solved, but apparently it doesn't. So very important. We'll move on to the next one.
Yeah, so this question is for Dr. Sheshagiri. Can people take sleeping pills for insomnia without consulting a physician?
Yeah, many people will give some sleep medication, will sleep better. Just like it is not so simple to take a sleep medicine without consulting a sleep physician. The reason is if you ask one sleep want to get better sleep, give a medicine, you'll get 100 of questions from the sleep physician. Why you are not getting sleep? Whether it is a sleep initiation problem, sleep maintenance problem, why he is getting any stress is there, any anxiety, depressive disorders is there, and then any pain is there. So your selection of medicine will depends on the underlying cause for why you are not getting sleep. So without that knowledge, you are not able to prescribe any medication. And sometimes some sleeping pills if you take like commonly induced sleep, like some sleep disorders may aggravate, like particularly the patient is having OSA kind of thing, choking spell in the sleep. Then because of that, he is not getting adequate sleep. That commonly prescribed sleep hypnotic medication, that particularly they will aggravate the. So like it is not advisable to, without consulting a sleep physician, to take medicine from, and then like so you need a proper consultation before taking any medicine, but you can take the medication. Best is to practice a sleep hygiene measures, what Dr. Ravindra has told to us. So if it's not improving, then better to consult a sleep physician for your.
Yeah, so not to take this lightly, please consult your physician before self-medicating. Yeah. So move on to the next question. Yeah.
So slightly switching gears to the interesting phenomenon of dreaming. So this question is addressed to Dr. Ravi Yadav. Do violent dreams in elderly signify serious brain illness? And as a corollary, generally, if you can enlighten us about the concerns from clinics, people with dream. If I have a violent dream, does it affect my personality? I mean, in that line of thoughts.
So the violent dreams may be witnessed by normal people also. But if they are associated with dream enactment behavior, then it becomes concerning, because dreams actually, I'm not an expert in dreams, madam, may tell further evolution, but if they are in isolation, then they do not pose any problem. But if there are dream enactment behavior, there are falls from the beds and injuries, which are known as sleep-related injuries, SRIs. So then they become a problem. So we have to evaluate the patient or elderly by doing polysomnography and look for a condition known as REM sleep behavior disorder, which is associated with the neurodegenerative processes. And there are very good medications to treat this condition also, so it can subside. But if there is no step taken, then it can be harmful to the bed partner as well as the patient himself. So that is the reason the violent dreams in elderly, if they are associated with sleep-related injuries to the partner or the patient himself, then it becomes a little concern.
Thank you.
The next question is to Dr. Ravindra. How do we follow sleep hygiene practices in relation to shift work?
So this is a very interesting, question, because the sleep hygiene practices which I told in a very ideal condition, but in reality, in many conditions, it may not hold good, because nowadays with 24/7 lifestyle and a lot of various of multiple shift works and all. So as far as the shift work is concerned, so it has been recommended that there should be 8 hours of shift. So it will be morning, evening, and night hours of shift. So people who are going for the night shift work, so before going to a night shift work, it has been recommended that they have to have a good nap before getting into night shift work, because here the goal is to have an optimal work or the work output during the shift work. It is not that during shift work we go and we doze off. So we have to prepare ourselves for our optimal performance during our night work. So better to have a nap or a sleep before getting into joining for the night shift. And also it has been recommended here, on the contrary to the normal sleep hygiene practices, to consume coffee or tea before getting into night work, and also during the night shift to have the bouts of coffee or tea so that we will be awake. But after the night shift, so it's better not to consume coffee or not to do exercise, and we have to allow ourselves the nature to take place, that we have a very good the catch-up sleep after the night shift. And also during the shift, it is also recommended that in between, okay, we should have some time for the exercise, like, so that we will be very active. And also, as already we discussed earlier in the first round, for exposure to the blue light or also for the bright light. So bright light exposure is one that prevents sleep. Also, otherwise, blue light exposure can also decrease the melatonin, because decrease of the melatonin will also decreases the hypnotic state also. So these are some of the things that has been specifically has been told as far as the shift, the work is concerned. But so how many, the blocks of shift should be there. So it is recommended that you can have 3 blocks of night shift. After the 3 blocks of night shift, okay, there is adequate time, at least a day or 2 should be given for the recuperation to happen. So generally in the younger days, in the younger age groups, because our system is very resilient, whatever the sleep depth has happened, because of the homeostatic process, so the catch-up sleep will definitely happen. But with the aging process, right? So we need to be a little bit more careful when we have a professional compulsion to have for the shift work. So these are some of the things which is related to shift work as such is concerned, especially with the exercise, light exposure, napping, and exercise is concerned.
So in a way, this is a way of artificially maintaining the light dark cycle.
Yes. Way to maintain that.
Facilitate activity.
Because our goal in the shift is to increase our performance during our shift.
Should they have more transients, like suddenly from night shift to day shift, or can they have?
Yeah, the sudden shift of the transient should not be there. So that's what it has been recommended. That's why it is given. You should have a morning shift, evening shift, and a night shift. So it is 8-hour shift. So there should be a smooth transition.
So that's why shifts are in 3 cycles.
Yeah,
8. Right. Thank you.
And also from the administrative, from the this point of view, it has been told that in advance notification also should be given to a person who is getting into a shift work, so that he prepares himself.
Thank you, Dr. Ravindra.
Right. So I think next one is a very relevant question, especially in modern times, as more and more people are having greater awareness of sleep hygiene, sleep, and related disorders as well. So many people are relying on sleep wearables. So the concern is, are sleep wearables accurate? So Dr. Anand.
I think it's very relevant. It seems in US they have reported recently that at least 15 to 30% of people have sleep wearables, and some of them are planning to use something like that is there in the recent survey. And it might be even higher, just underreported. But earlier the sleep wearables were only looking at motion, which we scientifically call actigraphy, and it was based on that the sleep and wake was timed. And we know the accuracy of actigraphy as such is not very good, especially if you have naps and sedentary kind of lifestyle in the daytime. It's very difficult to pick out the start of the sleep and those kind of things. But thankfully, over the years now, especially the wearables that are there now, they are they are based on multiple parameters. One of the major parameters they additionally use, other than the motion, is heart rate variability. And that's quite good to distinguish between light sleep and REM. So now they are able to identify that part reasonably well. People add few more parameters like respiratory cycles, and nowadays they even have temperature measurements in addition, and ambient lighting. They also have sensors which can pick up whether you have switched off the light, switched on the light, the ambient lighting conditions. So because of all these things, the accuracy have gone high. A recent 2018 to 2021 multiple reviews have been there. They have found that it is much better than actigraphies, and sensitivity wise it's very close to 90, 95, 96, etc. So but comparing with the polysomnography standard, gold standard, the accuracy is very high for light sleep and for transitions into REM. Their accuracy goes down for wake, from sleep to wake and wake to sleep portions, and many times the amount of entries, especially in the second half of the cycle. So this is where the accuracy is low. But light sleeps, they have very high accuracies, sometimes even better than an iterator level things. So if the idea is to see whether you are getting, if you are comparing your sleep across days, it is good, it is reasonably good, because you can do it, you don't need to even unwear. Start and offset, there is an issue. There are reports where it can go wrong. So maintaining a diary itself is good enough. And the amount of deep sleep that you have may also have some issues because the accuracy is not that great. Now, from an accuracy perspective, I personally feel it is much better than many times sleep diaries for quantifying whether a person is actually having sleep or not. Because subjectively, they may feel they are not sleeping. But these wearables have helped many people to identify that it is mostly subjective. As such, it is good because you can't afford to have multiple sleep recordings done in the lab. Now, the issue recently that has been raised is people have become highly concerned about sleep durations. We have magazines reporting 7 to 10 hours or 7 to 9 hours, and people stick to that. If it becomes 6.5, they are worried. If it becomes higher, already they are not worried, but there are people who worry about that also. In fact, there is some term, something. There is a new terminology that has been identified for people who are obsessed with the scores, sleep scores, and timings reported by wearables. So that's a new concern that is coming up.
We shouldn't be blindly believing.
So repeatedly checking in between the nights on those wearables. That's something the wearables have not been able to prevent. So as long as that is not done, that's a concern. So if people use it judiciously, it is wonderful. But too much reliance on the scores and other things will be an issue.
Okay.
To round up the second round of questions or queries, I'd like to ask Dr. Bindu to comment or elaborate on restorative sleep.
Yeah, so the theme itself, the theme of the World Sleep Day is quality sleep, sound mind, happy world. So that itself reflects on the restorative sleep. And you can find out whether a person has a, when a person says that I have had a good night's sleep, that itself is enough. That tells that he has had a restorative sleep. But now, if you want to know that, okay, scientifically, how you can quantify the sleep to be restorative. So if you do a whole night polysomnography, definitely you can see that they will have, so those who have had a restorative sleep, definitely their sleep organization is very good with high percentage of sleep efficiency, with reduced or with proper sleep onset latency, reduced intermittent awakenings, enhanced S2 and deep sleep states, N3 sleep state, and proper REM sleep state. So if you have this, definitely that is restorative. And why it is restorative? Because sleep is very important for health and well-being. For that, a deep, relaxed state of restoration is very important during night, and that is ensured through this sleep. For example, when you are into deep sleep state, and during sleep, during whole night sleep, you will be spending around 15 to 20% of your total sleep time into a deep sleep state. That is N3, we say. And this is this time is called as actually very deep relaxation time, because during the sleep we are entering into a hypometabolic state. That is, all our metabolic activities are highly reduced. You can, if you look at your heart rate is reduced, BP is reduced, respiratory rate is reduced, whole body temperature is reduced. And even other metabolically active hormones like cortisol. You can see by, in case of humans, especially you can see we call cortisol as the breakfast hormone. That is, activity is high during the day and becomes quiescent during evening and especially during sleep. So there is a sleep and cortisol is inversely proportional. Then you have to, sleep, you have to have a good night's sleep, but definitely the cortisol activity levels should be reduced. And this inverse relation is altered during aging, actually. So cortisol is reduced, and you can also see some of these anabolic activities. Say, for example, there is a growth hormone release, and growth hormone is very important for growth maintenance and the repair work. And also melatonin, for example, melatonin is also secreted during early morning, 3 a.m. So melatonin also levels are there even towards from the evening. So you can see melatonin is very important for maintenance of sleep. So all these are very favorable condition now. And your autonomic functions, there is a proper autonomic modulation happens during sleep. During, especially during a deep sleep state, you can see it is parasympathetically predominant. And this parasympathetically predominant sleep is definitely a deep relaxing sleep, hypometabolic state. It helps to maintain that hypometabolic state. And definitely, so that is the one, it should be ensured during sleep that you have to have 15 to 20% of deep sleep state. And as Arun said, it occurs in cyclical pattern, but still the deep sleep state occurs during the initial first half of your sleep. And also you have to definitely have proper REM sleep, because REM sleep is very important for emotional stability, mood, and that is because we say that there is an enhanced dopamine, mesolimbic dopaminergic activity that should be maintained, especially during wake and also during REM sleep. You can see this, and that is why we say that there is an affective brain homeostasis. This is very important for this affective brain homeostasis, and this kind of restorative sleep prepares you for a proper social functioning as well as emotional functioning. So that is what is meant by this World Sleep Day. You have to, how much ever busy you are, you shouldn't ignore sleep. You have to have a good night's sleep, and that definitely takes you, ensure your health and well-being.
We can't deny the fact that sleep plays a very important role in our well-being. So we'll move on to the questions.
We can quickly take some questions.
Yeah.
So one query was regarding sleep hygiene and food habits. Open to the panel.
So the question is, please share your experience about sleep hygiene and food habits. Yeah, see, food behavior and sleep are very tightly linked with each other because they share a common hypothalamic nucleus group, where both the sleep and the food, the satiety behavior and the hunger, they interact with each other. Now, as we get deprived of the sleep, or we get a sleep restricted, right? Our urge to consume more energy loaded food is increased. So it is all our experience also, even it's my own experience also when we are conducting the overnight sleep studies, right? We tend to eat more. So because to have that positive energy balance, because it will be more, our BMR will be more energy expenditure is there, and there is a natural urge to consume more and more energy loaded the food. Therefore, by sleep, we restricting our sleep because of our social life or because of faulty lifestyle, and then becoming addicted for these food is definitely it's not welcome. But otherwise, for a professional compulsion or an occupational compulsion, right? If we have a sleep restriction or the sleep deprivation, definitely there will be more urge to have food. But however, so we have to know that how to balance our sleep deprivation or the sleep restriction also. So otherwise, the sleep restriction and the food behavior are very much tightly linked with each other.
But I think food also has the type of food that we eat also has.
Yeah, type of food also has an influence on sleep. So that is that is also there.
Because I think there has been a recent report which in UK study, I think, they have done on a large population. In adults, they have found that people eating fruits and some fiber related foods, they tend to, after eating that, after 1 or 2 months, their sleep duration has increased substantially. So change of diet actually can cause this, and in children also. And on the contrary, there are claims that people who have very like sattvic kind of food, those kind of things, they tend to sleep less because the type of food we eat, like we have a fat-rich, protein-rich food. On that night, you tend to sleep longer. If you have a diet which is rich in all these things, because of the additional metabolism and other things involved, you might need to sleep longer. So such people's sleep deprivation effect also will be higher.
Also, just prior, like you had told that exercise is done just prior to sleep. Same way, heavy fat-laden food, spicy food, it can cause gastritis and GERD, and then lead to insomnia, disturbed sleep. So that way also, I think it.
Another question is the general experience that people find it very useful to sleep with some background slow melodious music without any vocal content or so. Is there any specific physiological link, or more broadly, like what are simple techniques you can use to get into a sleep state better?
So even when come to the sleep hygiene practices, so one thing which I forgot to tell is also about before getting into sleep, it's better to read something which is very soothing, or even listen to the music and go to a sleep state. So definitely having a very melodious music, and it will facilitate to get into sleep because it cools down, or it may be, or it brings about a calming state of mind and get into a sleep.
He was working with integrative medicine.
In fact, actually, many studies are now looking into how audio processing and stimulus processing happens during sleep. So from that perspective, throughout the night, though not in the same level, our brain is actually processing external information like sound. So people who have problem in sleep initiation, their prime concern is their brain is too active, thinking about several aspects on next day, current day, all those things. They are not able to calm down, and that's why they are not able to go into sleep. Sleep pressure is there. And for such people, listening to music, what happens, it's an entrainment. So bulk of your brain regions will now be entrained to something which is very predictable, music. So you go to predictable music or listening to audio streams like audiobooks, etc. They will take care of those regions which are now preventing you from going into sleep, and the rest of the thing, the sleep pressure will take care. From that perspective, it's actually good. In fact, people even listen to radios, some news that may be so predictable for them. Allow them
And remove the rumination part repeatedly. I think what.
Yeah, that's something important.
Yeah. Some comics tell you turn on the TV so that I can sleep.
In fact, those people switch on the TV.
Yeah, so again, contrary to the popular belief, people need not sleep in a sound, absolute zero noise.
In fact, in sleep labs where it is less than 40 decibel, they can't sleep. So low voice is not actually good for somebody.
Total silence.
They might want like some of the hotels. They want a fan with some sound to leave.
Yeah.
Bland music.
So another is more of a basic sleep research question. Why sleep architecture and sleep hours change as we grow old? From childhood to aged person, it differs. Why?
I think I'll take it.
Yes, ma'am. Okay.
Yeah. So this says that sleep is very important for various developmental activities. For example, you take brain development itself. So and when a child is born, and the child will be spending almost 16 hours in sleep and 8 hours in wake. And this is polycyclic, definitely. Sleep, wake. But if you quantify, you know that the child spends around 8 hours in NREM sleep and 8 hours in REM sleep. And this pattern of sleeping is very, very important for various developmental activities, because the brain development, if you look at the development needs two inputs. One is the sensory input. The other one is the intrinsic brain activity, like PGO spiking during REM sleep. So these are all very important for development for various proper synaptic.
Once they start with REM.
That's what. They start with REM, and REM is 8 hours of REM. Now you can see that as the child grows, there is a maturational process of sleep maturation, we call it as. And in fact, that is almost like a REM inhibitory process. So from 8 hours, it is reduced to almost 2 hours in the adulthood. Whereas NREM, from 8 hours, it is reduced to only 6 hours. So the major changes what we see is in the REM sleep. And this is very important, REM inhibition or sleep maturation. And whereas, as I don't know, has already discussed, many of these developmental mental disorders like schizophrenia, autism, you can see that this inhibition, this REM inhibition is almost disturbed. And that leads to various psychological and cognitive issues when they develop. And adult sleep, you know that we need to have, now we don't say that we need to have almost 7 to 8 hours of sleep. We say that we need to have enough sleep. So the enough sleep is required for you to wake up afresh without the help of an alarm clock. So that is a definition. We will not bother about the duration of the sleep now. You must be afresh. That sleep should be refreshing for you. Like you can see some of the advertisement, they get up and they smile and they do Surya Namaskara. So that itself tells that, okay, you had a good night's sleep. So this maturation process occurs. So, that is enough, that is sufficient. So sleep, the functions of sleep, if you look at, sleep has got varied functions. And one of the functions during development is, it is for proper development, proper brain growth, mental growth, and so on.
Yeah, so I think the rest of the questions were covered in the second.
Okay.
And I think bulk of the questions were with respect to sleep hygiene, what are the do's and don'ts. So I think with 2 rounds of discussion and the queries from the participants, it's pretty much clear that sleep is really important. And apart from the general concern, all of us should be aware about what are the sleep hygienes we can stick to, even though we think that, okay, yeah, it's okay, I can manage, but maybe it will precipitate into something bad later. So I think before we conclude things, since it's an expert panel, if each one of you can give one tip for all of us, I think that will be a good way to wrap up the panel discussion. Yeah. One tip each, so we get 6 tips.
Sleep is not a luxury, but it is a necessity.
Right.
I can say that, okay, keep your mind in Kelvinator before getting into sleep.
Cooling the mind.
Don't go to sleep in a very agitated mind. That is very, very important. We have to prepare ourselves to get into a sleep, as we prepare for so many other things. So we have to prepare ourselves to get into a sleep.
Dr. Shashidri.
Don't think too much about your sleep. You just sleep, you'll get sleep.
Very good.
That's the best solution.
Dr.
I think we are too, as a culture, we are too sensitive to external stimulus. We have to train ourselves to be less sensitive to external stimulus, even during sleep.
Dr. Gulshan.
Sleep for better health and better future.
Dr. Ariana.
I think exercise plays a very important role. At least half an hour of some brisk walk or exercise as per according to the age. That definitely not exactly before sleep, but morning or during some time in the day. That I think improves the quality and depth of sleep for sedentary people who are professionals. So that would definitely be very useful.
Maybe you could share some details about the sleep disorder clinic at NIMHANS, which might be of
Yes.
generic interest.
So it is almost now 1 year. We started a sleep disorders clinic at NIMHANS during COVID. So I just would want to inform everyone that we have this clinic on first and third Saturday in this specialty clinic block. And we cater to all these sleep related disorders, and we have experts who are myself, Dr. Sheshagiri, Dr. Ravindra, and in various aspects we try to help and cover the evaluation, expert opinion regarding various sleep disorders. So people can come definitely.
So people can get an appointment through the same NIMHANS portal.
Yes, and they can walk in. Actually, if as of now we have people can walk in,
All right.
and or referrals we also accept.
Thanks a lot.
Thank you so much. Thank you.
Thank you, everyone.
Yeah, thank you for making this panel discussion very successful, just because you are all attending.
Sleep well tonight.
Huh?
Sleep well tonight.
Yeah, live well, sleep well.
Thank you. Thank you very much.
Okay, thank you so much. Thank you all. Thank you. Thank you, Dr. Rajgiri.
Very well.
Yes, for doing this panel. Within a short notice. Thank you so much.
all.
Thank you all.
I have just shared our lab website, ccswebbing.com. So you can look up the website for further details of any of similar events happening, and you can even put a notification for the channel where things will be live streamed. And this particular panel discussion is live streamed in our YouTube channel. So any of you, if you want to share it with your peers, family members, you please feel free to do that. And you can also post comments so that a couple of concerns which cannot be addressed with this can be taken up in a next event. Thank you all and have a good night's sleep tonight.
Yeah, thank you.